Okay, maybe you have experienced this. Have you tried getting in to see a medical specialist lately? And emphasis here on try, by the way, because we have noticed time and again, the wait time for an appointment can take months to get you in. And this, of course, is our state health leaders, like Human Services Secretary Dr. David Scrace, have said repeatedly to not put off care during this pandemic. In many cases, though, there really appears to be some kind of a disconnect. And we're just talking about the metro here. So we sent Megan Abundis to find out what is taking so long just to get in to see a medical specialist these days. And Megan, I know it's complicated, but of course it is related to this pandemic as well.
It is. I mean, if you've tried to make a non-COVID related specialist visit, it's likely you've been given an appointment that's months out. Now, I've heard from many of you and hear your frustration, and I've got some answers.
Our health system should not be like this. We should be able to have specialists and not have an insane amount of time to get them in.
Selena Holmes-Smith says her children have dealt with rare conditions for years, and getting in to see a doctor has always been hard.
The wait times, the trying to get your child in pre-COVID is absolutely insane.
But she says now it's worse.
When your child is hurting and they can't hear and they're screaming in pain every night and they refuse to take a bath or whatever because the water literally hurts their ears and their speech is being affected, like their entire world is being rocked.
Stephanie Slater was also looking at long wait times.
Back in December, I noticed that my tonsils were larger than normal.
Last month, her primary care doctor gave her a referral to an ENT specialist.
They told me that the earliest appointment was in September 22nd. And that's for telehealth. And I'm like, okay, how can you see the tonsils if it's over the phone or computer or whatever?
Originally a 9-month wait time. She told her primary care doctor about it, who then did some heavy lifting.
And she convinced him to give me an appointment next month.
She said it was a close call because she was ready to voluntarily go to the ER for surgery. The State Department of Health says they're aware of the long wait times.
What's going on is when you delay care, when people delay care, there's not enough room when everybody wants to catch up.
While they say office capacities have played a role in it too, the root of the problem is the fact New Mexico has a chronic provider shortage, and it's had this shortage for years. The state said healthcare workers in neighboring states command a higher salary, and school debt is a challenge for recruiting and retaining here. They said the need for change is clear, and the ability to change for the better can come if lawmakers are willing to strive for the right mix of government policies. We reached out to 2 big hospital systems to see what they were doing about the wait times. UNM and Presbyterian both acknowledged the pandemic has worsened them. Dr. Darren Schaefer, the president of Presbyterian Medical Group, said they're trying to be creative in attracting doctors to the land of enchantment.
We've recruited 190 over the last 12 months to add to our teams, but we still know that's not enough. And there are some specialists that are certainly even harder to recruit to. You mentioned ENT, I would say neurology, and even rheumatology.
As they see the wait times, they say they've added online visits, real-time video visit, urgent care visits, and the new Pres Now facilities. UNM Hospital said they've expanded specialty care, broken new ground for more care, and continue to work with colleges to recruit and train more providers in New Mexico. Again, Dr. Scrace said while closing a lot of healthcare facilities last year was the right thing to do, we are seeing a surge, and it's going to take some time to get everybody in. Tessa.
Can absolutely understand why people are frustrated with this. Megan, thank you for all of that insight.